Infectious diseases is a subspecialty where you can make an impact. And in terms of having a mathematical background, the ability to use a statistical inference regarding populations and then make a change that affects entire populations of people as opposed to a single person on a single encounter was intriguing. Hepatitis C is a virus. It is an RNA virus, and it is transmitted through contact with blood and body fluid. The major routes of contact would be tattoos or intravenous drug use or needle sharing. It has to be blood, and transfusions before 1989, although the people who had such transfusions are becoming less common as the time since 1989 passes, when the blood was tested for that. When I was at Pittsburgh, my mentor was Monto Ho. He, along with a doctor from Stanford, Thomas Merrigan, were the people who described the use of interferon. And interferon in the initial treatment of hepatitis C was integral in its treatment. Hepatitis C is a virus that can mask itself very well from the immune system, and it does so by changing itself. And to augment the immune system was a way of treating hepatitis C in the early stages. And we used interferon in conjunction with a drug called ribavirin with varying degrees of success. Somewhere between 30 to 50% of people would respond depending upon the type of hepatitis C. Then we learned to incorporate interferon with pegylation, so we would only give it once a week. But that interferon drug could make people very sick because it gave people symptoms of the flu either for 6 months or for almost a year in conjunction with ribavirin. And these people accepted that with about a 50% chance of response. Now, knowing what we were able to do with HIV, when we understood the virus and understood how it worked, it was felt to be a much better way to approach hepatitis C by developing direct-acting antiviral agents that would jam it up. Now we have second-line protease inhibitors and a polymerase inhibitor, and these drugs actually are giving us 95% cure rate for hepatitis C. In terms of years of life saved for these patients, avoiding hepatocellular cancer or avoiding transplantation, adding years of life saved, and taking people out of the community who could potentially transmit hepatitis C to others should they relapse behaviors, or should they engage in getting tattoos and somebody's not practicing tattoo artistry the way it should be and transmit. So we take people out of the community who could transmit this illness, and we actually cure and save lives. For this and for other things, I'm honored that somebody would consider me to do that. I think that it represents me doing my job, and I look forward to doing that in other areas in the future.